Hi everyone, welcome to the Zero Fat Diet. Today I would like to talk with you about Ayurveda and why it is very dangerous and why nobody should be following Ayurveda or going to Ayurveda clinics or practices, anything like that. It is a very dangerous pseudoscience, and it's actually more harmful than can do any beneficial thing for you. First of all, I want to say that I'm doing this video because of recently there's been some things where I just came upon some Ayurveda proponents who were trying to say how good Ayurveda was, and the fact is it is not, because it can cause major liver damage. The treatments, the herbal treatments like turmeric and ashwagandha and all these herbal treatments are so toxic to the liver that you can develop liver disease or need a liver transplant. And this stuff is not regulated. So I was listening to a liver doctor in India, and he's graduated from several medical schools in India, just regular, mainstream medical schools. And he has his own, practice of, he's a liver doctor. And what happened is people were coming to him with severe liver damage, and so he specializes in alcoholic liver disease. So he was examining his patients, but so many of his patients were like, "Well, I don't drink alcohol. I don't drink." And he's like, "Well, what's really going on here? What is damaging your liver?" And what was the common theme was they had all very recently begun doing Ayurvedic treatments. They were doing Ayurvedic therapies, herbal tinctures, herbal remedies. And these herbal remedies were causing the liver damage. And some of those patients needed liver transplants. And so they were able to do biopsies on livers and found these toxins in the liver. And they have now researched these ingredients and found the toxicity level is so bad that I just want to give out a warning to people about how bad Ayurveda is. And it's based on a really faulty principle of your prakriti, your nature. It's based upon the doshas of kapha, pitta, and vata, and balancing these doshas inside the body, which is really dumb, because if you think about it, like, for example, if someone has high cholesterol, it's like any human being could take a statin and lower their cholesterol, regardless of what your dosha is, regardless of what your nature is, the statin is going to be effective. And so it just seems really lame to me how they would take this approach to the human society that, we're gonna put all these people into these three doshas, and everything's gonna be just individual. Well, Ayurveda has totally failed me in the past when I actually used to somewhat be open-minded to it. I couldn't do any of the food on the food lists of any of the doshas. So it was like totally ridiculous. It doesn't even work. But let me get to talking about this a little better. Basically, the Ayurveda, it's considered false or unproven for any heart health from a modern scientific perspective, and that's primarily due to a lack of large-scale, rigorous clinical trials. The theoretical basis is not aligning with modern medicine and significant safety concerns, including heavy metal contamination. It's classified as a pseudoscience, The theoretical foundations of Ayurveda, such as the dosha balance system, are considered pseudoscientific because their premises are not based on modern scientific principles. They have insufficient clinical trials. There is a scarcity of well-designed randomized controlled trials, those are called RCTs, that meet Western scientific standards to prove the efficacy of many Ayurvedic treatments for heart diseases like hypertension or coronary artery disease. They have unproven claims, products that claim to reverse heart blockages or cure heart disease. They lack scientific proof and can give patients a false sense of security, which may delay necessary conventional treatments like angioplasty or bypass surgery. And they have variable results. So studies have shown promising results for some individual herbs like Arjuna or Gugul in lab settings or small studies, but these often lack standardization and long-term toxicity evaluations, meaning they are not considered definite proof of efficacy. But here's the real kicker, is the heavy metal contamination, as I was talking about. A significant number of Ayurvedic preparations, particularly those following the Rasa Shastra tradition, which incorporates metals and minerals, have been found to contain toxic levels of lead, mercury, and arsenic. There's a lack of regulation. In the U.S. and some other countries, Ayurvedic medicines are often classified as dietary supplements and are not subject to the same stringent safety and efficacy standards as conventional medicines. And there's potential for harmful interaction. So if you think you're going to be with your conventional doctor and get your treatment, but then have Ayurveda on the side, think again, because certain herbs can interact with conventional heart medications, e.g. statins, blood thinners, potentially reducing their effectiveness or causing harmful side effects. And delayed conventional treatment. Reliance on unproven Ayurvedic remedies alone can lead to patients delaying or foregoing evidence-based medical care, allowing serious heart conditions to progress silently. Other things is that I'm going to go here and give you a couple of situations. All right, here we go. So there has been many people who have died in the treatment with the treatment of Ayurveda, and there's a couple of instances just to point out, like in 2022, a 37-year-old woman named Seema Pravin Haribai died from liver failure after taking Ayurvedic herbal remedies for arthritis. The coroner explicitly stated she died as a consequence of the administration of Ayurvedic medicines. There was also a 35-year-old hepatitis patient took Swarnabhasma, gold salt, and had her liver injury worsened. A 26-year-old student developed severe lead poisoning from Ayurvedic medications requiring chelation therapy. And it is said that 20% of Ayurvedic medicines contain potentially harmful levels of lead, mercury, and arsenic. Some preparations have been found to contain lead and mercury at 100 to 10,000 times greater than the acceptable limits. About 20% of Ayurvedic medicines fall into a class called Rasa Shastra, which intentionally combines metals and minerals. The resulting products have been associated with hundreds of reported cases of lead poisoning. All right. So, let's talk about this, the yoga myth. The language of yoga is often laden with unproven concepts such as chakras, energy centers, prana, life force energy, and nadis, energy channels. While these ideas are integral to the philosophical and spiritual traditions from which yoga originates, they are not supported by empirical evidence. Claims that specific poses can balance chakras or unblock energy flow fall outside the purview of science. And they can't back up their claims on this. And so, like yoga, like people who practice, yoga, asanas, yoga stretching and stuff, scientific studies prove that yoga is not superior to conventional stretching exercises. And yoga is just as effective as stretching, strengthening exercises, no better, no worse. And the benefits that people attribute to yoga are simply the physical benefits of stretching and strengthening muscles, not any mystical properties. Now, Ayurveda is not regulated by any authority. This creates a dangerous environment where harmful substances can be marketed as medicine without proper oversight, as I was saying before. All right. So basically, to sum this up, is that Ayurveda is very dangerous due to the heavy metal contamination that causes poisoning. There's a lack of regulation allowing harmful substances. There's fatal liver damage from herbal compounds. And there's a false confidence leading people to avoid proven treatments. So I advise very much against Ayurveda. And I just wanted to put that out there for everyone. And if anyone was thinking about beginning an Ayurvedic treatment, or if someone has cancer or heart disease or diabetes, I would not approach any Ayurvedic clinic or whatever you call those places where people go for Ayurveda. I would not seek that at all. And that's it. If you have any questions or comments, feel free to write down below. And thanks for listening.